Hello, welcome to NurseWorks in association with Tropical Pine Tree. Today I'm going to be talking about flu shots and how to make them less painful for the patient and also for the nurse. When thinking about flu shots, or any other injection for that matter, people have a pretty fixed set of emotions. One is fear, and another is the loss of control in the situation. These two emotions may express themselves in childish behavior or an angry outburst. As a nurse facing a day of giving injections, there's another set of emotions and feelings differing from that of the patient. So let me first express both sides and then see if it's possible to find a happy and educated medium. There are two sides to every story and to every injection. Who hates them? Well, most everybody. The video is geared to both you, the patient, and to the nurse. I'm going to pull back the curtain on a window you never suspected even existed. We're going to talk about the nurse. Most nurses are completely competent to give injections. However few like to give them. The number reason is we don't like to cause pain. Some nurses, particularly new nurses, fear jabbing too deep and hitting the bone or nicking a blood vessel. If the patient moves or pulls away during an injection, the nurse is in danger of getting stuck with the needle and possibly run the risk of becoming infected with a life-altering disease. There is a lot of paperwork and medical appointments and labs required of both the nurse and the patient in that case. It is both expensive and emotionally draining. Some nurses don't like the drama. Kids screaming, kicking, and trying to get away. Grown men crying and begging you to make it not hurt. And people holding their breath to the point of fainting. And there are angry people demanding you hurry up and get it over with. The nurse who has been given an assignment of giving flu shots to a room full of people will have a lot of thoughts going through her head. And the nurse, just like you, will have good days and bad days. They might not have slept well the night before or are recovering from a cold. Some nurses are distracted because emotional problems. Some are feeling the stress of understaffing and are experiencing burnout. The patient, although he may want the flu injection, is less than thrilled about the process. They remember when as a child they were forced to sit still and take it. They are feeling stress that they didn't account for and are now facing the long side of a needle. Stress can make some people act childish, asking the nurse a myriad of questions of how long will this take and can you make it less painful? To, am I the only one who acts this way? Some people become angry and think the nurse is taking too long, maybe even trying to torture them a bit. It is a lot of drama that many nurses don't want to face. Since neither the patient or the nurse knows in advance how the other will be reacting, it can cause anxiety on both sides. So, buckle up, Buttercup, and let's figure out what will give you the best outcome. A painless, drama-free injection. And those wonderful words, "You're all done." So what do? Before you come and get your injections, take a few steps. Learn a relaxation method that you can use while this procedure is being done, whether it's meditation or something else. Take a pain reliever beforehand and apply a tropical painkiller to the site. Shake your arm. Don't let it rest on the table, but let it dangle because a relaxed arm will cause less pain during an injection. There are certain things your nurses have to do in order to get ready for the shot, like the paperwork, your signature, and these things have to be done, so just chill and let them happen. How do you treat your nurse? Just like with anybody else you meet, you be polite. You might ask about her day. Don't insist she does something not possible, like making it not hurt or making it go faster. Don't make her have to calm you down before she does her job. You might want to grease the wheels by bringing a flower or a piece of candy. You don't have to. She'd never expect it. But it's things like that, the little things, that can make things more pleasant for both of you. Now on to more technical things that you should be aware of. The shot you receive should be given in the deltoid muscle, or in the upper arm. It's a small triangular area. The size of the needle should be in relation to how much muscle mass you have. The size of the needle needs to be adjusted for smaller people under 130 pounds or for larger people over 250 pounds. The reason is, if the needle is too long, it could hit your bone, and if it is too short, the vaccine may not get into your muscle properly, thereby being less effective. It can be safely given through a tattoo. The nurse should be wearing gloves. Most nurses do not aspirate before injecting a flu shot, but some do. Aspiration is a practice of placing the needle in your arm and pulling back to see if any blood goes into the syringe. In the flu vaccine, this isn't necessary because there are no major blood vessels in the deltoid area. Aspiration is painful, time-consuming, and it can contaminate the syringe. Here's more than you probably want to know about the alcohol wipe. A pre-packaged sterile alcohol pad is recommended to maintain sterile technique. The nurse needs to use 2 wipes, one for the vial of vaccine and one for your arm. Both these places need to be completely dried before the injection happens. A wipe containing at least 50% alcohol will kill funguses and viruses. They will kill most viruses and bacteria, but not spores. Vials should be checked for the name of the vaccine and its expiration date. The information, along with the serial number of the vial, needs to be placed on the patient's chart. Vials need to be stored between 35 and 46 degrees Fahrenheit, and the vial is good until the last day of the month indicated on the vial. The virus is grown in egg protein, so if you are allergic to eggs, avoid getting the flu shot. Stabilizers such as sucrose, gelatin, and polysorbate 80 are used to stabilize it for transportation and storage. Polysorbate 80 is problematic as it's used to treat chronic kidney failure, and it also is used to help drugs pass through the blood-brain barrier. Aluminum salts are added in order to stimulate an immune response to the killed virus. Aluminum salts is a neurotoxin and has been linked to Alzheimer's and dementia. In order to prevent bacterial contamination, formaldehyde is used, and that is a human carcinogen. And then also mercury is added to multi-dose vials to prevent contamination when a needle enters a vial, because there is a risk that it will be exposed to impurities. Mercury is a toxic heavy metal linked to the suppression of your immune system. Penicillin and other sulfa drugs are added to prevent contamination. Because of the negative impact of mercury, some vaccine manufacturers have begun to create mercury-free vaccinations. Here's what you need to know about the vial of medicine. After it is opened and wiped with an alcohol wipe, the medicine needs to be drawn into the syringe. There is a pocket of air at the top of the vial that doesn't need to be removed before you get the med. In fact, trying to push out the air, you run the risk of some of the medicine escaping the syringe, causing you to get less than the optimal amount of medicine. The amount of liquid in the flu shot is 0.5 cc's of medicine. This is 1/10 of a teaspoon. You need to tell your nurse if you're prone to fainting after a shot. In most cases, this happens within 15 minutes of the injection. It may shock you to know that people have fallen and hit their heads and died as a result, so don't try to tough it out. You might ask, what if some of the medicine leaks out or you jerk away and not all of it gets in? Well, since it's hard to know how much you've received, you can get another dose if you want, and it will not harm you. Tell your nurse if you have had lymph nodes removed from under your arms. It is then up to the nurse's judgment and discretion whether or not you should get the injection. If you have a clotting or bleeding disorder,
Your nurse will need to use a smaller gauge diameter needle and then hold firm pressure over the site for 2 minutes. There is a technique in giving shots, and we've already discussed the aspiration angle. You don't need the extra time and pain involved. However, there's a couple of methods taught to nurses. Number 1 is aim it like a dart, but it's not a very controlled shot. You don't have control over the rate or the depth. We're told to go slow, but you know the longer it takes, the more pain you feel. And then some people wonder why their arm is black and blue after a shot. Well, your nurse needs to be quick, but not so quick that her knuckles hit you in the arm. And that is the equivalent of giving a shot and being punched in the arm at the same time. Come ready to ask questions. Look at what the nurse is doing. If you're concerned about receiving the wrong medicine, check out the label on the vial. Ask about the length of the needle, and by all means speak up if you might faint. You might need to go to your doctor to receive the injection if you don't meet certain health standards.
Thank you for watching. If you found our video helpful, please pass it along to somebody else. And be sure to like us and subscribe. You can support us through Patreon. Look at our cool rewards.